The U.S. is averaging 100,000 new coronavirus cases a day. That is the highest in daily cases since February. Unfortunately, the number of people vaccinated is not enough to keep hospitalizations and deaths from rising. According to the CDC, about 61% of adults are fully vaccinated. 71% have already received at least one dose of a vaccine. States in the South with lower vaccination rates are struggling the most. In Florida, more than 80% of hospital beds are occupied. The state keeps breaking records for new daily cases. On Friday, the CDC reported nearly 24,000 new infections across Florida, and it's not just adults who are struggling. New cases are rising among children in the state, which is concerning because students are heading back to the classroom this week. Governor Ron DeSantis has blocked schools from mandating masks. Louisiana is another state where the virus is worse than ever. The number of unvaccinated people being hospitalized are overwhelming the hospital system. CBS News Debra Alfarone reports.
COVID hospitalizations in Louisiana are at an all-time high. At Baton Rouge General Hospital, the ICU is meant to hold about 25 patients, but more than 70 COVID patients need beds. So the hospital has converted 4 hospital wings to make room. Almost all of the COVID patients are unvaccinated, like 61-year-old Douglas Allen.
You can't move because you don't have the strength.
Even still, Allen is not 100% sure he'll get a vaccine when he's able to. Doctors say the misinformation about the vaccine is difficult to combat.
You see all the misinformation out there. I can understand sometimes why they make the decisions they do. When you read those lies, they're scary to a lot of people.
The CDC says about 61% of U.S. adults are fully vaccinated. President Biden's top medical advisor, Dr. Anthony Fauci, says he expects the FDA to fully approve the vaccines this month, which could lead to new vaccine requirements at the local level.
That could be colleges, universities, places of business, a whole variety, and I strongly support that.
Children under 12 are still not eligible for the vaccines, as school is set to begin. The National Institutes of Health reports over 1,400 children are currently hospitalized with COVID, the highest number ever recorded. Despite Dr. Fauci's recommendation that schools require masks in the fall, local and state officials are divided. New Jersey and California schools will require masks, but Florida Governor Ron DeSantis signed an executive order banning schools from mandating masks. Debra Alfarone, CBS News, Washington.
Joining me now is Dr. Kartik Cherabuddi. He is an epidemiologist and associate professor of infectious disease at the University of Florida. Dr. Cherabuddi, welcome. As you know, more children in Florida are getting the coronavirus just as the school year arrives. They cannot be forced to wear masks under Governor Ron DeSantis' executive order. How do you expect this to impact the spread of COVID-19 among children?
We are seeing an unprecedented number of children turn positive for COVID-19 in Florida. We're seeing them have mild disease, but we're also seeing increased hospitalizations in children. The more important thing also is children can have symptoms that last 4 to 6 weeks after they get infected with COVID. So once the school year starts, if not everyone is masked in the classroom, then those who are not wearing a mask will be asked to quarantine even if there's one case in the classroom. This will disrupt the school year and the learning for kids. We all know in-person learning is extremely important for kids, and we all want to get that done. We are all on the same page. The best way to get this done is by having our kids mask up, start school. Those who have additional conditions or cannot wear a mask can be allowed to not wear it. And we could try accommodating them in virtual school. But for the predominant number, the safest thing is to have masking in schools. We are doing this in Alachua County, and the other counties are joining in as well. I think overall we can get this done by having kids masked. They're resilient, it's safe, it's the right thing to do.
And doctor, as you said, children are, this time around with the Delta variant, are getting more sick than they had with the previous strain. Can you explain what sorts of symptoms you're seeing in children as a result of the Delta variant? And do we know why it is producing more severe symptoms in some children?
think one of the most important things is just the numbers. The higher numbers of kids are getting infected. So some kids could have small immune deficiencies that we don't know of, genetical abnormalities that we don't know of. Also, certain risks like diabetes or obesity, even in children, is quite rampant. So those could be factors, but we're seeing that they're present almost initially with flu-like illness. This seems to progress where the fevers stay high, and some of them are being admitted with the inflammatory syndrome that occurs in kids. The other kids who have other problems, those problems are getting worse because they're infected with COVID as well. So we're seeing both things happen.
And so are you seeing, as a result in Florida, of increased hospitalizations for COVID due largely to this Delta variant? And I'm asking now across the board, not just with children, but also with adults. Are you seeing that at least the death rate is not spiking along with the hospitalizations? Are there better treatments available so that not as many people are dying? Or is that wave of deaths still to come?
Yeah, I agree with you. I think it's twofold. One, deaths usually follow admissions by a couple of weeks. We've seen that with every single wave. We would see some lower deaths because we have better treatments and because we're seeing a younger population get admitted. But our ICUs are full. Our intermediate medical care units are full. The emergency rooms are full. When this happens, we know that death rates go up. We know this from New York. We know this from London. We know this from India. The death rates go up when your hospital systems are overwhelmed. And just looking at our ICU numbers, that shows us that people are getting severely critically ill. And that is concerning.
And so, as you know, Austin, Texas has declared an emergency alert. It was sent to residents via text saying, quote, the COVID-19 situation in Austin is dire. Healthcare facilities are open, but resources are limited due to a surge in cases. Doctor, what does an emergency alert like this mean exactly? Is this simply a way of the hospital system saying to the population, if you get sick, we may not be able to help you?
Yes, we don't pass these emergency laws in cities or counties lightly. You can count on fingers how many times it's been passed over the last few years. This allows us to take care of the extremely sick patients only. At the same time, it means that people seeking care for other conditions might not get it. It means that ambulance services might be delayed. So delay in care can make things worse. This allows us to use other emergency methods that emergency rooms can then employ, where we might even triage patients outside the emergency room, so on. So it gives us hospitals a way to do things, but it also means for the city or the counties that things are getting really serious, that we are at our limit there. And we're seeing that locally in Gainesville, in Alachua County as well, where an emergency alert has been passed.
All right. Well, Dr. Kartik Cherabuddi, thank you so much for all that you're doing there at your hospital. And we certainly hope that your message resonates, that people take care of themselves, and we can do everything that we can as a community to beat this virus. Thank you so much.
Thank you for having me.